Okie doke. Well, welcome this evening. I am Steph Goldring, the CEO here at Vets for Climate Action, and a big welcome to everyone for our free April masterclass, Practicing Veterinary Medicine Sustainably, Decarbonising Veterinary Care. And it's a topic very close to our hearts here at Vets for Climate Action. Um, so VFCA's strategic plan identifies education as a core pillar with the goal that all veterinary professionals understand the impacts of climate change on animals and are ready to act. Central to this is our climate care program, a structured program designed to educate and empower veterinary clinics to understand why and how to reduce their carbon waste. The climate care Program Advisory Committee plays a key role in achieving this, providing veterinary and animal care expertise to guide and strengthen our program. And that's from recommending content, improvements, and identifying gaps to promoting the program across networks and engaging with professionals, with the profession at industry events. Tonight's speaker has engaged with our program as well as utilising his own techniques to reduce his practice's carbon footprint. But before we go any further, apologies, I've gone too far. I would just like to acknowledge and pay respects to our First Nations people and acknowledge country. So at Vets for Climate Action, we acknowledge and pay respects to our First Nations people, past and present, and welcome any Aboriginal or Torres Strait Islander folks joining us tonight. I live on the lands of the Gadigal people, which is just here in Sydney. I invite you in the chat to share the lands you're on. Traditional owners have cared for this country upon which we work and meet for over 60,000 years, its lands, its oceans, its rivers, its trees, and its wildlife. We endorse the Uluru Statement of the Heart and acknowledge that this land has never been ceded. Our First Nations people have long understood the deep-rooted connection between healthy people, animals and country, which ties in well with the veterinary concept of One Health, an important tenet of our work here at Vets for Climate Action. And for those who might be joining us for the first time tonight, Vets for Climate Action is a movement of vets, vet nurses, practices and industry partners across Australia who care deeply about protecting animals, people and the environment from the impacts of climate change. We work to inspire and educate both within the profession and in the broader community, promoting sustainability and advocating for strong science-based climate action. At Vets for Climate Action, we believe that animals need a voice in the climate conversation, and we're proud to be that voice. If this speaks to you, we'd love to invite you to become a member or get involved with us. There are different ways to do that and jump on our website, which is www.vfca.org.au. I'll just run through a few housekeeping matters. So tonight's session will run roughly as follows. We have been advised the presentation is a good 50 minutes, so lots of details in there. But there should still be time for questions at the end. As I noted, the webinar is being recorded and will be shared online for those unable to attend in person. If you prefer not to be recorded, please turn off your camera and change your display name to something anonymous. We ask that that you please keep your microphone muted during the presentation. By all means, come off at the end for any questions or drop any questions in the chat as we go along and we'll get to those. You're also welcome to reach out to us at info@vfca.org.au if you have any questions after tonight's presentation. Now, I will hand over to the chair of our climate care program, Dr. Jeremy Watson, to give an introduction to our guest speaker, largely because this is a topic that is very, very close to Jeremy's heart. And I know that he and Diccon have had a number of conversations over various months. So Jeremy, over to you.
Look, thanks very much, Steph, and very pleased to have Diccon here to present tonight. With our climate care program and with our goals at Vets for Climate Action in general, we're really trying to achieve two things with sustainability in practice. Really, we want to reduce our carbon footprint and get our own house in order. And then we want to use our influence to effectively inspire 2/3 of the population who own and care for animals, that we've all got a shared interest in the future of animal health and doing something about climate change. And so that first component of getting our own house in order is what Diccon is very good at, and we're very pleased to have his expertise here tonight. It's very much an emerging field of which he is at the cutting edge. So a little bit about Diccon's background, and I know he's a Melbourne graduate like myself, and a few others I think are joining tonight. So Diccon has got an honours degree in veterinary science and is also a Diplomate of the American College of Veterinary Internal Medicine, and is a veterinary neurologist at VCA Animal Care Centre in Sonoma County, and the 2025 recipient of the Simon Doherty International Green Award at the Veterinary Green Awards. He holds dual sustainability leadership roles as Sustainability Clinical Implementation Lead for VCA, part of Mars Veterinary Health, and as a Director of the Veterinary Sustainability Alliance. He published research and Diplomate American College of Veterinary Internal Medicine, so researcher, and Diccon has also led his clinic to a 14% reduction in carbon footprint and brings both scientific rigour and practical experience to the challenge of decarbonising veterinary care. So perhaps I best just throw it over to you, Diccon, and you can walk us through what you've learnt and what we need to do next. Thank you.
Thank you. I'll just share my screen. So can you just confirm that you can see that just fine?
Yes, thanks.
Excellent. Well, thank you very much for that kind introduction, Jeremy. And yeah, let's crack on. So let's begin with a question. What is the impact of healthcare, the problem? So the Australian healthcare sector accounts for about 7% of the country's annual greenhouse gas emissions. This compares to in the US, where it's about 9%, and then globally it's about 4%, and it really depends on the intensity of care you provide. And when using GDP to translate for veterinary care in the US, I calculated it was about 0.25%, or about 12 million tonnes of carbon dioxide equivalents, and that ranks veterinary care as a country about 100 out of 260, or the equivalent of Puerto Rico. So unfortunately, providing care for our patients also has substantial impact, both from greenhouse gas and warming, but also from other effects on the environment. And so we need to mitigate this. This is an extension of the do no harm principle. So in this discussion today, I'm going to really emphasize the impacts of energy, including electricity, travel of our clients, transport of materials and supplies, and our commute. And also maybe continuing education travel or other business travel. We'll look a little bit at procurement and delivery, that too. Something about medical equipment, supplies, pharmaceuticals, and touch on anaesthesia. I will not be going into great depth about waste, food and water, etc., or preventive care, pesticides in this particular presentation. Now, once we understand the problem, the next question we need to ask ourselves is the solution. Can we practice better? And the answer categorically is yes, we can. And then follow up with the question, well, how can we create less emissions and have less environmental impact? And we can do this in large part by reducing or even eliminating carbon-emitting energy sources. This is really the key to decarbonisation. And then reduce excessive energy loads by increasing energy efficiency and being less wasteful. So let's really find a path forwards. And we have two great beacons, and there are these two current exemplars. One on the left is a photo of the Canberra Hospital Extension. This is the first all-electric hospital in Australia, with many others soon to be completed. And then we have Bringbank, a practice in Western Melbourne, and the very first net zero vet clinic in Australia, where they have solar panels that produce more electricity than they use, with on-site battery storage. Also provides resilience and some grid independence. They make best use of natural light. They're very energy efficient, and they've installed exceptional insulation, have a state-of-the-art ventilation system, and have electrified their clinic, no longer using gas for heating, with also an EV charger to boot, and so much more. And who's that? Well, it's Jeremy Watson, my introductory person. So and also the owner of this practice. And he is truly a climate leader and living proof of how easily it can be done. So the best way to further understand our impact, and specifically our greenhouse gas emissions, is by dividing them into various categories, and that can really help us understand and tackle them in the most impactful way. We can then account for those emissions by creating a greenhouse gas inventory, and the Greenhouse Gas Protocol is globally recognized and divides emissions into 3 scopes. So the first scope on the left there in blue, that's scope 1, about 19% of emissions in healthcare in Australia. And this is mostly associated with heating, so central heating, maybe heating the waters as well. If you have a mobile practice, a large animal or mixed practice, then much of that might be consumed with mobile combustion. And then we also have waste anesthetic gases. Scope 2 is mostly associated with electricity purchased when it's generated from fossil fuel. And this would be accounts for about 9% in Australia. And then we have scope 3, also indirect emissions, but this is mostly associated either with avoidable, so that could be waste or business travel, transport, food, that we actually have some control over, and we'll talk about that in a little bit. And then the other part of that is that it's much more embedded, much more difficult for us to have control over, such as pharmaceuticals, medical equipment, supplies, etc. And every hospital will have different levels of emissions from each scope. So we need to do an audit, if possible, create a baseline, a benchmark, if you will, of your hospital's carbon impact. And a carbon calculator is an easy tool to use. So this is one from the Veterinary Sustainability Alliance. And we combined work with Colorado State University and a master's student, Terry-Ann Kyrie, and we created this EPA emission-based calculator using all 3 scopes. And so what you can do is you can use your previous gas, electricity, water, waste, and purchasing bills, including anesthetic gases, when building out that greenhouse gas inventory. And then you can utilize that information detailing your greatest carbon impacts, and that can help you prioritize changes. And so what we did is we said, well, look at this great big green column here. What can we do about this? And we realized that our local utility actually had 0 carbon electricity that we could purchase. So we did that, and we nulled that to 0. And so immediately we could get rid of 14% of our emissions. We've actually now done many other things, but just to show you that as an early introductory change that we made at our hospital. And then for every action you're going to take to reduce your environmental impact, you want to consider these 3 factors. The first one is impact reduction balanced, so in carbon. Balanced with then the increasing cost to implement and ongoing costs. And then you also want to think about the ease and effort of implementation, including staff time and job disruption. Now, efficiency actions, although they can be less impactful, can be some of the most easy to implement, allow you to sort of gain traction onboard staff, and they're often called low-hanging fruit. So starting small is important, but you just can't rest there. We need to build from there. So an example here would be maybe the little yellow circle. That could be installing yellow LED lights. If we're thinking about a hybrid version of that, or maybe if we don't have to reinstall ballasts, etc., throughout the hospital. Blue here circle, that might be improving the building envelope with insulation, or maybe replacing your HVAC system with a heat pump system. And then for each action your team's going to take on, you're going to need to set attainable goals. And you want to start with a baseline, which is what we were just talking about with the carbon calculator, and then try to create an attainable target. And then use an action-based timeline to plan out your action. Then you implement, obviously, the action, and then you finally follow up. And that's really the most important step, that documentation of the progress. Because that reassessment and responding, particularly to impediments, is exceptionally important if we want to drive continuous improvement, because it's very much an iterative process. And because implementing many actions needed often require substantial support. We would recommend you form a green team or sustainability team, often comprised of like-minded individuals. And so you can then take the right steps to implement some of these more impactful actions. And I think it's really important that the team can be multidisciplinary and maybe can represent all different areas of the hospital, or some of the departments at least. And maybe you would like to have different parts of the hospital involved. So it could be veterinarians, it could be technicians, custodians, your front desk staff, and then management. A buy-in is also really important. And this can really help collaboration and coordination of resources and ideas, and can really help implementation through general staff awareness. And the role of the team really should be to facilitate the transition with practical, measurable, implementable actions, and clearly communicate those benefits to all stakeholders. And that includes your clients and also the community at large. And I think it's important also to emphasize that the purpose of the interventions is not to deprive. People often think, well, you're changing something, I must be going to do without. But that's not necessarily the case at all. We're actually trying to have you long-term thrive by doing things better for the environment, for your staff and clients, patients, and actually often savings for the business. And also perception is important too. So it's very important that any implemented actions do not either have a wrong perception or actually reduce the level of veterinary care provision. It should only enhance. So at our hospital, we have regular meetings every month. We divide up assignments and roles. We try to hold each other accountable where we can, and set and manage expectations, and enable each other by providing resources, time, space, and funds. And then listening and responding to feedback's essential. And so we have a little suggestion box in our break room. People can then anonymously, or they can write their name and tell us what works and what doesn't. Where do they want to push back? And implementing their ideas, if they have a new idea, is a great way of then driving engagement, buy-in. That sort of sharing ownership can really empower. And we've had great success with certain areas of our hospital when we've done that. And then for broader reach and help, definitely consider collaborating. Maybe it could be a sister hospital, and we've done that now with multiple local VCA hospitals. So it could be through corporate, or it could be through your local veterinary medical society or other as well. And then always you want to celebrate your wins. We did this when we transitioned locally to zero carbon electricity, and we created this great banner pictured here with my hospital sustainability team that I'm really proud of. And so before I launch into all the many actions you can do in detail, I do want you to kind of go through understanding our impact, and the need to set the stage and understand some of the really big drivers of emissions and associated problems. So there are three main greenhouse gases, I'm sure you're aware, causing global warming. And many of these are also emitted through energy use. And so carbon dioxide, and then methane and nitrous oxide. So carbon dioxide makes up the majority. And before industrial times, it was only about 278 parts per million. And now we're already at 430. And this is an increase of more than 70% since pre-industrial times, mostly coming from the burning of fossil fuels. And then when considering its global warming impact over 100 years, compared to other gases, we're going to assign it an arbitrary 1. And then methane, which has much greater warming potential, has about 30 times that of carbon dioxide over that time period. It's increased by 264, so a massive amount over the last 150 years. And nitrous oxide, with a very long half-life in the atmosphere, also has a really high global warming potential, albeit much, much lower levels in the atmosphere. And so we can see when we look at this pie chart that I created here that when we look at a breakdown of percentages in Australia, carbon dioxide accounts for about 65% of the greenhouse gases. This compares to America and many other countries, which are close to 80%. And one of the reasons for that is there's an outsized amount of methane being produced as a percentage in Australia. On average in the rest of the world, it's more like about 11%, and nitrous oxide also being higher at 11%, whereas the rest of the world is more closer to 6%. And we can also see just from this beautiful graph here from Climate Change Tracker that the majority of carbon dioxide does come from the fossil fuel industry. So if we look a little further at the sources of methane and nitrous oxide, methane makes up about 90% of natural gas. This is a fossil fuel, and much of it does come in other countries from the fugitive emissions from pipe well losses, etc. But most of it actually in Australia, as you can see here, comes from livestock and a much lesser amount from waste dumps, rice paddies, etc. We can really reduce these impacts by preventing and regulating and capping those methane leaks from the fossil fuel industry, but also changing the way we farm, and especially by reducing the number of ruminants, and to some extent reducing the methane production per animal, but that's going to have much less extensive effect. And then nitrous oxide comes from fertilizers and agricultural soil management, as you can see here, a huge amount from agriculture, and also to a lesser extent from fossil fuels, etc. Now, so clearly regenerative farming and improved land management is going to be very important for the future if we're going to reduce the warming impacts of these gases, because in Australia particularly, methane and nitrous oxide has a really outsized impact. And when I first started researching this for Australia presentation, I didn't realize this, but I think those in large animal practice and mixed animal practice, could really make a big difference in the way people farm and manage their animals, and contribute substantially to reducing those emissions. Now, due to those massive greenhouse gas emissions that we're eliminating into the atmosphere, we're warming rapidly. So today we've already breached 1.4 degrees warmer than pre-industrial levels in the last decade. In the last 40 years, every decade in the last 4 has been warmer than the previous. And the last 11 years have been the warmest on record, with 2024 being the warmest of all. In fact, the reason this is called the temperature anomaly graph is, in fact, we should actually be on a cooling trend since the 19th century, according to the Milankovitch model, based on the Earth's tilt, precess, and orbit. And this makes, therefore, the rapid warming even more alarming and clearly anthropogenic or caused by us. So currently, about 90% or a little bit above of Australian energy is generated through the combustion of fossil fuels, and it's the greatest contributor to emissions. And not only that, as you can see here, 34% of renewables are not clean. They're involved from combustion of wood and other biofuels, which is actually very polluting. So one of the very most important ways for us to decrease our emissions and pollution is to reduce our dependency on not only those fossil fuels, but on those other combustibles. So in the short term, those biomass combustion actually can contribute significantly to warming and pollution. And so although they're considered renewable, we need to realize that they actually, just like fossil fuels, can lead to many other harms, which include global warming, climate change, and quality effects like pollution. So, as stated every year since 2009 by Costello et al. In Lancet, the climate crisis is absolutely a health crisis and the biggest global threat of the 21st century. Air pollution, particularly, and this was a great study done by Lancet in 2000, or a Lancet study in 2019. And it showed there are about 7 million premature deaths globally every year. That's a death ratio of about 1 in 6 worldwide. In some countries like India and Nepal, it's about 1 in 3. And that's because they have significant indoor pollution from cooking poor quality fuels. Even in the US, it's about 1 in 10 due to pollution. And 20 of the 30 most polluted US counties are actually in my current home state of California. And we also know that 90% of the hardest hit are of low and middle incomes, and this also then affects pet care. Now, there are lots of other areas that health is impacted through climate change, and these include things like heat, drought, environmental degradation resulting in forced migration and civil conflict, which we're seeing around the world now. Both in Australia and California, we've seen a lot of wildfires and the effects of that. And then changes in vectoral ecology, severe weather and floods, including all the hurricanes that we saw in the Carolinas last year and in America, and then also water quality impacts, etc. And the cost of air pollution is huge. You know, in Australia, it's about $24 billion a year in health effects, much greater in the US, maybe 700 billion. Still accounts for about 3% of GDP in Australia and even more in America. 3,200 deaths every year, with many magnitudes higher in the US. And more than half of that in Australia is due to transport. And we'll be talking about that later in the session. And then global air pollution, again, 7 million deaths a year, about 7% of GDP, a whopping amount, and about $8 trillion in a year as well. So then let's turn our attention to try to decrease the impact of how we use energy. And this is going to go through two main ways. We're going to use less energy, particularly dirty energy, and then obtain as much as possible from renewable, clean electricity. When we think about energy consumption in healthcare, we've got to remember that energy is vital to every aspect of practicing both human healthcare and veterinary medicine. So the aim is not to deprive, but rather not be wasteful, which is also going to save us money. And this graph shows us where the majority of energy flows on site in a US human hospital. And just to note that the US hospital, or any human hospital really, uses about twice as much energy as any other commercial building per square foot. And more than about 70% of that energy is used to heat and cool buildings, heat the water, and provide lighting, as you can see here. So we want to electrify everything, and that's going to take on those scope 1 emissions. And then we want to go to clean renewable electricity sources, those scope 2 emissions. So starting with scope 1, that's about 19% in Australia. In America, somewhere between, depending on the reference, 7 to 21%. So direct greenhouse gas emissions, these are those that are either owned or directly controlled by the veterinary hospital itself. They could be from a stationary source, so an on-site natural gas or oil heater, a water heater, a clothes dryer, a combustion backup generator, something like that. If you have a mixed practice or large animal practice, then fleet vehicles or grey fleet vehicles, which are those where you are paid for using your own vehicle. Those will make up a substantial contribution. And then to a lesser extent, waste anesthetic gases and tiny bit from fugitive emissions from AC and refrigeration. And so when we electrify everything, we can massively reduce that. And then we'll also talk about how we tackle those waste anesthetic gases. So to do that, we would want to put in a heat pump water heater, dryer, maybe take on an EV, install EV chargers, which would be a really great idea. Many of these EVs now do 600 kilometers mile range, so you can readily eliminate those emissions. We want to look for appliances that really have a high energy rating label as well. That's very, very important. And then for home and small businesses, there are now rebates for electrification in different states. Saul Griffiths, he actually created Rewiring America. He was an MIT graduate. He's an Australian guy. And now he has Rewiring Australia. He's an amazing man. He helped put some of the IRA for America a few years ago. And he's now doing his damnedest to reduce emissions in Australia. So do look for his books. And I'll introduce a little bit more about him later when we talk about it. But he, in Rewiring Australia, he's got some really great information there. And yes, as he said, it will actually cost you less. The other thing would be to put an appliance replacement plan by contacting your local installer. And then you'll be prepared, even if you're not ready yet, to get rid of that gas appliance. When it does break down eventually and can't be fixed, you can replace it straight away with a much better state-of-the-art heat pump. So now let's move on to improving energy efficiency. So this is often somewhat low-hanging fruit. It has some effectiveness, but there's certainly easy gains to celebrate. So the cheapest and easiest way is going to be to be more efficient and reduce that use. And I would definitely suggest you consider contacting your local utility provider. We did at our hospital. We got a walkthrough and an energy efficiency assessment report, which is really helpful for us to get started. So something very simple you can do is to switch off appliances and lights. We have these beautiful little stickers in our hospital on light switches that do not have occupancy lights. If you do have those motion or automatic switch off, that's better. And then also put in those appliances into power down or sleep modes where you can as well. If you have appliances that do not have those built in, you can get smart plugs to remotely time use periods. You could install LED lights. We've done that throughout our hospital. Use natural light, as Jovi showed. And then also we've got those at our hospital with skylights. And then all the offices pretty much at our hospital have windows to the outside, and so do our surgery suites. And so that allows us to use best use of that daylight too. You should certainly consider purchasing highest energy rating labeled readily serviceable appliances as well. And then also think about where those appliances are. If you've got a refrigerator, you want it well ventilated so it can work as efficiently as possible and not next to a heater or something like that as well. And then for more egregious uses of energy like laser printers, either consider using a inkjet printer or maybe not using one at all, and then also avoiding use of paper. Think about things like setting your thermostats in winter to slightly cooler and maybe in summer a little warmer. Those in office spaces maybe dress for the season using a ceiling fan. In the laundry, definitely combine washing loads, getting a commercial washer, which is usually more efficient, washing on a cool setting with appropriate detergents, and certainly consider using a clothesline instead of a dryer. We've done some of that at our hospital as well. And then also consider building upgrades, including things like insulating your hot water pipes. We did that. That was a pretty simple step. We also went through and sealed all outside doors, and then also gaps and cracks. And then, maybe a next step up from that, obviously, would be to improve wall and roof insulation, maybe increasing building shade with eaves, retractable awnings, and maybe plants if that's appropriate for your practice. And then another thing about windows is that they can also lose a lot of heat or gain a lot of heat through them. So it's important also to try to prevent that. And there are these window films that are pretty cheap by 3M and others. Or if you can, go to triple glazed windows. Now, I also want to introduce a concept of committed emissions, and Sol Griffiths is really passionate about this. These are these emissions that are locked in for the life of the machine or the appliance. And if we think about a car, that's 10 to 20 years, hot water furnace or heater, maybe 10 to 15 years, etc. So we've got to stop building these machines that use fossil fuels and combust, resulting in those CO2 emissions as soon as possible. And otherwise, we're going to either be left with a stranded asset that we can't use, or way too much accumulated atmospheric greenhouse gases and associated warming. So he and I would suggest that your next car should be electric, your next heating system should be an efficient heat pump, etc. And those of us that can afford to do so really need to drive that electrified economy and push all companies to produce those cleaner machines, because if we don't demand it, there will not be the supply of it. So before we leave scope 1, I do just want to talk about anaesthesia. So this is when we directly exhaust waste anesthetic gases from the hospital into the atmosphere, and these can have substantial warming depending on the anesthetic used. And you can see here that nitrous oxide is about 300, so global warming potential over 100 years, about 300. Desflurane, which I think very few of us use, there was some equine vets using it for a while for faster recovery. But this is being phased out even in humans, the healthcare field. Scotland no longer uses it. Much of the UK is now banned it, and I know that many in Australia are doing the same thing. Isoflurane, about 500, and sevoflurane, about 100. So transitioning to sevoflurane would be a really great thing to do if you can. Certainly consider discontinuing. I think very few of us are using nitrous oxide now. Another thing is lower flow. Now, this is not no flow, or this is not a closed circuit. This does not require full anesthetist supervision, etc. This is just not wasteful. So if you have an animal that's greater than 3 to 5 kilos, you can use rebreathing circuits usually very easily. If you have a relatively up-to-date anesthetic machine with light silicon valves and you use a pediatric circuit, then usually you can use pretty slow flows without having any problems at all. You do want a capnograph, and you do want, a reasonably well-trained technician, obviously, but these can be way lower flows than using a non-rebreathing circuit. Other things to do to help reduce MAC would be to have good analgesia with opiates, judicious use of alpha agonists, using a regional block, local anesthesia, or maybe total IV anesthesia, which can have up to potentially a magnitude-fold less emissions than even sevoflurane. Now, we do need to put this into perspective. So if we think about the NHS in the UK, if they take out nitrous and desflurane from the equation, their anesthesia only accounts for about 1% or less of their greenhouse gases. If we think about it on a global level, again, isoflurane and sevoflurane really account for 0.01 or 0.001% of that warming potential. And then we should also note here, as you can see, this great article from Dr. Jones and West, that using sevoflurane for 1 hour at 1 litre per minute of oxygen is equivalent to driving about 6.5 kilometres. Thus, most clients create more emissions driving back and forth, dropping their dog up from the hospital, than they're going to be caused from using sevoflurane. Now, gas capture, anesthetic gas capture, is slowly in the works. They did a great pilot in the UK last year. They're going to be doing another pilot in the US this year. Very excited about that. But it is imperfect and still only captures about 40% of emissions. And then you've still got to transport those canisters around and then reclaim that anesthetic gas. So there are some very simple things we can still do to massively reduce the amount of anesthetic gas that is released into the atmosphere. So for scope 2, now moving on to the electricity. So this is indirect. This is something that we're purchasing and bringing into the hospital. The emissions are created elsewhere. So this would be from electricity generation that comes from fossil fuel combustion plants and accounts for about 9% in Australia, generally healthcare. In America, somewhere around 11 to 15%, depending on the institution, etc. And when we transition to zero carbon electricity, we can basically null that effect. So switching to solar, wind, geothermal, hydrokinetic energy generators are going to be the way to go for us to really reduce those emissions. And as you saw, reduce my emissions immediately by about 14%. So we did that at our hospital. And then I've also done this at home. And obviously, Jeremy has also done it at his practice too. And then we can see here that in Australia, generally, electricity now in 2024, about 36% was made up of clean renewable. Now, it depends on where you are in Australia. So for Tasmania, it's about 98% is clean, and that's because they have so much hydropower down there. South Australia is also doing very well, as is Canberra. And then Victoria and New South Wales also making a pretty large impact there too. And I found that in the States as well, that many electrical utility suppliers now are providing pretty simple opt-in to those renewable and at low and declining cost differentials. So certainly seek out your utility, and if you can transition to zero carbon electricity. And you can also consider adding PV solar and battery storage, as Jeremy did, for more power independence and control. Now, in the last 25 years, there's been a huge surge in renewable electricity with concomitant reduction in cost, as you can see here, with solar electricity generation absolutely plummeting. And so in Australia now, solar power and onshore wind is considerably cheaper than fossil fuel versions of electricity. And in 2023, my hospital transitioned to Evergreen, that 100% renewable, now zero carbon electricity source. And you can see it's zero here. So California average for the utility, which is actually a pretty clean state, is about 358 pounds of CO2e emitted by each megawatt hour. And if you compare that to other parts of America that might be more based on coal, they could be up to 800, or Hawaii, which has actually got mostly oil, which surprised me because I would have thought they would have a lot of wind or solar. There's a huge amount of oil, and they're more like 1,000. So, definitely for those areas and for other states and territories in Australia, they're not as clean. Transitioning where they possibly can, practices in those areas to renewable zero carbon electricity is very, very important to lead the way. And then important to celebrate, we did this with our local community at our local Chamber of Commerce when we transitioned to zero carbon electricity. We had a bunch of businesses come, and some local, the general public also turned up, and we also got good press traction as well. And the really important thing, the way this is a win-win, is that we actually then continue that collaboration. So we then won a large e-bike grant, and we managed to get 4 e-bikes and a storage facility through a federal grant with the help of our utility. We're also now, we'll be installing, at long last, 9 EV chargers at our hospital as well. We also got to co-advertise and market with them. And then the other thing is that now when we've got those EV chargers installed, we're actually going to be able to move to a cheaper time of electricity use in the late AM and early PM. And so that's going to drop the cost of all our electricity for when we use it the most throughout all of our energy use. And we have a huge MRI, which consumes a lot of electricity. So that's going to save us a lot of money. We're very excited about that. Now, concerns are often raised about the potential impacts of renewable energy on wildlife and agriculture. And this is often important, but also overstated. And Angela Frimberger, the founder of Vets for Climate Action, has written to the Australian government actually on this, to the House Selection Committee. And it was a great article she wrote. But when we compare those global impacts of climate change and pollution from fossil fuel combustion to the localized risk associated with renewable infrastructure, the problems are small and increasingly being mitigated. And in many cases, actually, those renewables coexist really well with agriculture and such can support biodiversity. So on your left here, we can see an example of merino sheep grazing under solar arrays. This is called an agrivoltaic system that allows livestock production and solar energy generation on the same land and can actually provide a farmer with another source of income. And they actually showed that those sheep produced more and higher quality wool. Similarly, onshore wind facilities have reduced bird strike mortality by about 70%. And they've done this with using visual blade cues, sensor-based slowdown systems, acoustic deterrents, better site selection also, so they're away from bird flight paths. And then for context, on the right, domestic cats in the US back in 2017 were killing 10,000 times more birds, and all US buildings were killing 3,000 times more birds than wind turbines. Now, for scope 3, we then move to this huge area encompassing about 72% of emissions. Some of them are much more avoidable, and that includes waste and travel, food and water. And within this accounts for about 20%. And then 50% approximately, these more embedded, and that could be pharmaceuticals, medical equipment and supplies, and other. So when we add up, though, all of those scope 1 in blue, the scope 2 in green, and then those more avoidable scope 3 yellow, we can actually save potentially 40 to 50% of emissions. And I think that's really important for us to understand, and should be really potentially very inspiring for you. So let's briefly touch on procurement. These are much more embedded, as we talked about, potentially, particularly those medical supplies. And historically, recently, we've been using a linear economy where we have had very much a take, make, sell, use, and then a discard. To be sustainable, we really need to evolve a circular economy that maintains those materials within more of a reuse, repurpose, recycle circuit, thereby limiting that resource depletion, that energy input, and waste accumulation. After all, getting the most value out of the resources that we already have, and keeping them the highest utility and value just makes good business sense. Now, every product and most services impact the environment in multiple ways across the value and supply chain throughout their lifespan. This is called the life cycle analysis, and it's really crucial to understand that there is a real need for veterinary and health care industries to rethink the design of products and services to minimize their environmental impact and over their lifetime, and particularly things like planned obsolescence. And there are ways we can do this with service plans instead of just buying a new piece of equipment each time. And then we should also look for products with certifications such as these you can see listed here, and many others. And then long term, we should also think about, striving for companies to take back products at the end of use for product recycling, particularly for electronic products. And as Jeremy has said before, this can also help a manufacturer differentiate their product in a carbon-constrained world, certainly very much part of the extended producer responsibility conversation. And then you can also get your supply maybe to consolidate deliveries, and also maybe take back packaging for reuse rather than energy use, high energy using recycling, such as these reusable totes. And we're now expanding this throughout the United States. And then also really encourage your suppliers to move to maybe an EV delivery. There are now lots and lots of EV light trucks on the road in America now. And some of the warehouses where we get our supplies actually now have solar on their roofs to power their buildings. And then importantly, also have your hospital team coordinate and work closely as well together to consolidate ordering and limit that need for dollar and carbon expensive expedited or air freighted deliveries, for example. And then obviously always be on the lookout for greenwashing. So other things we can do around procurement is we can also avoid. So one way we can do that is the costs incurred from expired medicine can be up to about 2% of a practice's total revenue. And the manufacture of medicines results in substantial emissions. According to Healthcare Without Harm, on average globally, it's about 17% of scope 3 emissions. So something we really don't want to waste. And so when a vet hospital uses good inventory management, such as this one, it's going to reduce the labor and space required for those supplies. It's going to reduce the costs, and then for also reduce waste and emissions. Other things we can do is a simple thing, like avoiding transporting distilled water around. So we use distilled water for our autoclaves, dentistry, lab equipment, coffee machine. But when we transition to a water distiller, it's going to be much less cost over time. I found out that some very large hospitals are using thousands of dollars worth of distilled water a year. These are very energy efficient. They don't create any delivery emissions when you're transporting all that heavy water. And there's no single-use plastic bottle use either. And then we can also avoid when we don't use as many nitrile gloves. And in healthcare, some studies have shown up to 73% of gloves are used unnecessarily, and that can therefore avoid manufacture and those delivery emissions by not using all those gloves. In US healthcare, we use about 25 billion gloves a year, and the manufacturing of that is equivalent to driving a car 1.8 billion miles, which is just a staggering amount of carbon being released. And so, a very effective way is to also to decrease your use by replacing it with good hand hygiene. So when we do that, we can also improve staff safety, in fact, and staff hand health, and reduce cost, because unfortunately, these gloves often provide an illusion of quality improvement. It's actually been shown that, in fact, there's a clearly demonstrated increased risk of contagion and cross-contamination when gloves are not removed promptly after a patient examination, when insufficient hand hygiene is employed after use. So something that's very, very important to consider is the amount of nitrile gloves we're using, and can therefore also reduce the amount of spend. And I know that some large hospitals as well spend many thousands of dollars in nitrile gloves every year. So I co-wrote a paper last year, and if any of you are interested in reading more about this subject, then please don't hesitate to read that and contact me if you have any questions. So finally, we're going to talk about transport. So when thinking about transport, we want to consider the staff commute, business and conference travel, and also our client travel. And transport has one of the highest CO2 emissions of any sector in the US, in Australia and in the US. In Australia, it's about 18%. And when we think about cars and light trucks, this accounts for a whopping 63% of those greenhouse gas emissions. And then there's also the associated air pollution from road transport. Flying is actually the single most costly carbon-emitting activity for an individual. But when we add it all up, it's the cars and trucks that we drive around that are really causing a huge amount of emissions from transporting ourselves on our roads. So when we thinking about this, we want to really try to decarbonize transport as much as possible for our clients, staff associates, and when we're doing our continuing education or business travel. So thinking about carpooling, ditching diesel, combining errands or short trips, regular vehicle maintenance might seem silly, but that can make a big difference. Keeping tires appropriately inflated can. And one of the greatest things you'll ever be able to do is actually switch to an e-vehicle. And this might be actually one of the very most impactful purchases you ever make. And then where possible, preferably walk if you're in an urban environment and you're close to your clinic, or cycle, or take public transport. And we're incentivizing this at my hospital. We have 4 people that carpool. And actually this has an outsized effect because they actually were the ones that were traveling the greatest. So that really made a big difference. We have 3 staff members that commute regularly on these e-bikes, with 1 being used for lunches or weekend sojourns. And then we have these EVs that are coming in as well, which our clients will also be able to use, as we were talking about. And then always celebrate. This is a Facebook post, I believe, for one of my technicians. This is Jenny and I, when we picked up our e-bikes from a local distributor. And then for our clients, if you don't have EV chargers for them, also just consider providing patient service through the least number of visits, or utilizing some level of telemedicine where appropriate. We can also consider that. So telehealth is actually used extensively in human healthcare, and it can provide substantial reduction in greenhouse gas emissions as a corollary positive effect. And there are opportunities for expansion in veterinary medicine outside the classic imaging interpretation setting. Now, there are controversies surrounding this, and as a veterinary neurologist, I can tell you, I cannot do a virtual exam. I can have a look at gaits and other things, but there's a lot that I can miss. But for vet-client-patient relationships, for limited delivery of timely veterinary care, for follow-up visits, follow-up gait analysis even, telemedicine can be very useful. And it's really important to point out the distinction where telehealth is actually the broad term. And we've been doing it for decades. Teleconsultation is where, it's a virtual consultation where a practitioner might ring up a specialist. It could be a lab, or it could be a surgeon or an internal medicine doctor. That's teleconsultation, getting more information there. Teletriage, that's when a client calls up and about their sick dog, and you're not actually providing a diagnosis or treatment, but you are helping to facilitate that timely care. And then, of course, we have the telemedicine, which requires that VCPR, and you should check with your state board as to whether that can be done virtually or needs to be done in person. We should also really note that telemedicine can really help provide care to rural, remote, and underserved communities and help address that health provision inequity. So as we end the session, I hope you are now inspired and see that transitioning to sustainable practice is absolutely doable. We've got to take agency of our circumstances because many of the solutions are very much in our hands. And if we just look again at electricity, residential and business commercial, of which veterinary hospitals and staff are included, consume or use 60% of this production. So if we could work to transition to 100% renewable, zero carbon electricity and electrify homes and clinics, we would null out the vast majority of Scope 1 and all Scope 2 emissions. With some work on transport and procuring a lot better, particularly using reusables, which is where we're really going to make a huge impact. Again, we can head towards reducing our emissions by that 30 to 50%. So definitely think about doing these actions, going 100% renewable, carbon-free electricity, electrifying everything, increasing your energy efficiency, flying less and driving less, reducing your waste anesthetic gas, procuring better, consolidating deliveries, reusing where you possibly can, and understand your carbon and ecological footprint, divest from fossil fuels, including from your bank and your retirement portfolio, and then read widely, think critically, question everything, including everything I've said today, and then investigate it all and talk about it. And so that's what I really want to emphasize at the very end, that amplification of our effort to reduce our impact through that. Collaboration is really key. This is how individual actions can rapidly grow many magnitudes to create a tidal wave of change. Just imagine 3,000 vet clinics in Australia with more than 40,000 employees, hundreds of thousands of associated family members, friends, wider community associations, through worship or hobbies, etc. You can make so much difference on all and influence all these people that you have contact with. So let's get out there, be informed, be responsible leaders, and reinvest in our future. And thanks very much.
Thanks, Diccon. That was stepped out so well what needs to be done. Really appreciate it. I'll just get you to stop sharing your screen if that's okay. Oh, thank you for the plug there of our climate care program. Diccon's
I just
basically...
quickly add that my hospital did complete this carbon care program. And one little plug for me is that if you're in the US, we have a Green Paw certification, or in Canada, if you want to do that, and then I will stop sharing.
No problems. No, thank you. And honestly, anyone considering their climate care program, Diccon has probably summarized it in the last presentation. So there you go. You've got it without having to subscribe. But in all honesty, do consider what your next steps are. And if you wanted to reach out and ask any questions, Jeremy and I are both available. Now, we did answer some questions as we were going through the presentation. But does anyone have a question that they want to ask Diccon or Vets for Climate Action? You're very welcome to come off mute and put your video on, and we'll try and have this finished ASAP because it's now 2 o'clock in the morning for Diccon.
Yeah, I actually had a question, if you don't mind. Great presentation, as always. I was just wondering, like, considering, I guess, the expanding corporate environment in Australia with veterinary practices, it sounds like from your presentation alone that there's a lot of practices, like corporate practices especially, can gain in respects to financial growth as well through just transitioning to a more sustainable practice environment. So on that, like, what do you think are the biggest barriers to corporate practices entering a more sustainable work design? I understand upfront costs are traditionally a barrier for smaller practices, but considering these practices traditionally don't have that problem, I guess I'm really just curious to know, what do you think are the main barriers for larger practices?
Well, I think actually that there should not be a barrier. I think that, I'm I'm part of Mars and VCA hospitals in America, Banfield, Blue Pearl, and then in England, there are multiple there too. Business units there. And what we've been able to do is utilize our ability to scale and then procure, whether it be electricity, whether it be cheaper goods and services, work across different business units and think about what we could reuse, how we could reuse it, working again with scaling and procuring. So those reusable totes that I showed you, we're rolling that out throughout America. And then we don't have all of the recycling that we used to have with all those cardboard boxes, for instance, etc. So I think that it's in their hands. Mars is a leader. They have a goal to be net zero by 2050, to halve their emissions by 2030, 35. And I really think we're on par to do that. I think that this is absolutely doable. And it's by coming together and breaking down those barriers that you were just talking about that it can absolutely be done. And if we demand it, the supply will come. And if you have, literally hundreds of thousands of veterinarians across the world all demanding these things, then those suppliers will have to act and they'll have to change their policies. So I think that this actually, we are leading, and we hope that others would join us and lead in this fight for a cleaner future.
Thank you. Thank you.
Thanks, Diccon, for that considered answer.